There are 12 major criteria involved in the development of a trauma-informed system. And this comes from a document called the Blueprint for Action. I'm going to go through it very quickly. It starts at the macro level and moves down to the micro level, or more to the individual service provider level. The first criteria is, and in Canada we're working on this, to get somebody at the provincial level and certainly at the federal level to have a designated focus on the whole issue of trauma in our society. We would also, in a trauma-informed system, have either a national strategy on trauma-informed care, certainly position papers on trauma-informed care. That's a very important component of being a trauma-informed system. The whole area of workforce recruitment, hiring, and retention is very important, and in particular, the whole area of educating our service providers. At KidsLink, we've been talking a lot to Wilfrid Laurier University and certainly to Renison at the University of Waterloo and to Conestoga College about integrating trauma-informed theory into curriculum for those of us that have chosen to work with people, no matter what sector we're in. In terms of orienting and training our staff, a major component of a trauma-informed organization is that there's a standardized training program for staff on trauma and the role of trauma in the lives of the people that we work with. That's supported by job descriptions, job standards, performance evaluations, and other systems in an organization that promote their staff to use the trauma lens in working with people. Number 5, the real importance in terms of involving trauma survivors, involving the people that we work with in establishing their right, really, to have trauma-informed services, for all of us to be educated and understand the effects of trauma. The other piece is the financing criteria for funders and for organizations to devote resources to implementing the evidence-based and promising practices that we see for our clients and for our services. And if we don't deliver trauma-specific services in our organizations, the importance to partner with others who do, it can't be stressed enough. The other piece is to have clinical practice guidelines for working with children and adults in trauma, with trauma histories. And in fact, I would advocate for policy and legislation that requires those of us that are working with vulnerable populations to use the trauma lens, to understand people's experience by asking them what happened to them and not what's wrong with them, and particularly children. And to also be an organization that would have policies and procedures and rules and regulations which support a movement to be trauma-informed in, hopefully the most positive way, to avoid re-traumatization. I think that's really important. And the movement to reduce restraints, as I mentioned, is one of those. To have needs assessments, evaluations, and to understand the research on trauma, which I gave you a small piece of, to ask trauma survivors about their reaction and response to the services that we've offered them, and to monitor how we work with people, and to look for a way to evaluate our ability to integrate and implement trauma-informed theory. And there are a number of toolkits out there that can help, and there's also some really great work being done on evaluation in terms of these 12 criteria. Universal trauma screening and assessment, asking the question, what happened to you, is really what that's about. Or partnering with others that can help us, help our clients really identify the major issues. Collaborations among trauma-informed services and service systems are key. We cannot all be treating trauma. But no matter what we do in our services, to be trauma informed, to understand that role, I think is what we're looking for. To partner and to collaborate in a community that can work together to support children, youth, and adults who've experienced trauma is a major factor, major criteria in the science of trauma-informed care. And then I mentioned trauma-specific services. To adopt a trauma-specific approach that could be evidence-based if you're in the business of providing services to families. I want to tell you about some of the toolkits that are out there for organizations to implement the science of trauma-informed care. There's a number of them. I mentioned the one that was developed by SAMHSA. There's a child welfare trauma training toolkit that's extensive, and these are all free online through a number of sources that I can point you to. There's a child trauma toolkit for educators. There's a toolkit for working with refugees. And there's also a trauma-informed organizational toolkit for homeless services. There's some new ones coming out that I've just discovered in the last couple of days as well as I've been preparing for this. There is a toolkit for judges, which I think is brilliant, and I'm certainly going to share with the Crime Prevention Council, and hopefully we can post it on our website. And there's also now a new toolkit for women in the domestic violence sector. The way that the trauma-informed movement is taking up speed in the U.S. in particular is that Trauma and Justice is a strategic initiative of SAMHSA. Their new strategic plan came out in November, and you'll see that reducing the pervasive, harmful, and costly health impact of violence and trauma by integrating trauma-informed approaches throughout their health and behavioral health systems is a major strategic initiative. So we'll be looking to see what happens there. I'm going to go through very quickly what's happening in Canada. We're catching on. There's some things happening certainly in Ontario. KidsLink's implementing the sanctuary model and has been for the last 4 years. We've got a number of others that are working together. A little bit more about KidsLink. Also, an organization in Manitoba has a wonderful toolkit that they've got posted. This is Clinic in Winnipeg. And then the British Columbia Center of Excellence for Women's Health, and in particular mental health and substance use, has a really top-notch toolkit as well. There's lots going on, we hope, across Canada. We're working together to try and bring the science to all of the sectors, no matter where we work. And it's much, much more complicated than what I've talked about in the last 50 minutes, but I'm really happy to be able to give you this introduction. There's something that in my reading that came up for me related to my colleagues' work in BC in the whole substance abuse area that really sort of touched me. And it was a quote from one of the therapists who says, "I have come to believe that trauma is the problem and substance use the solution until the solution becomes the problem." Where do we go from here? Well, very quickly, as a service provider, we really want you to think about whether or not developing a trauma team in your organization makes some sense. We want you to share up-to-date research and knowledge and really collaborate with others on building awareness and seeking training on more in-depth training on the theory and practice of trauma-informed care and trauma-informed systems work. We really, if you treat clients specifically, we want you to think about the implementation of a universal trauma screen. By asking what's happened instead of what's wrong, I think that we can really work together to change the system. Conducting thorough trauma assessments or partnering with others that do is important. And then offering trauma-specific treatments, absolutely important. In terms of policymakers and funders, we'd really like to see more regional and provincial-wide standing trauma task forces. We would like to see the development of written policy on trauma-informed service systems. And, if we could, we'd like to establish a clearly identified trauma office in government. And we would also like to see coordination across ministries. That's it. I really want to thank the Waterloo Region Crime Prevention Council for inviting KidsLink to do this presentation. Care, and that you can work together to bring this knowledge to others. So thank you.